Welcome to H&HN Daily's Accountable Care Series. I'm Hayden Bush, Senior Online Editor for Hospitals and Health Networks magazine, and I'm joined today by Chris Van Gorder, President and CEO of Scripps Health in San Diego, to take a look at accountable care organizations as well as a new initiative that Scripps is launching. Chris, thanks for joining me today.
Thank you. Glad to be here.
Well, Chris, before we get into the broader question of ACOs and the federal program, I'm interested in how your new integrative care network works into that picture and some of your hopes from that initiative.
Well, what we've been able to do is pull the 7 groups that are affiliated with Scripps, 2 integrated groups, Scripps Clinic and Scripps Coastal Medical Group, and our 5 other independent groups, or IPAs, or large medical groups, come together in what we call our Physician Business Leader Cabinet. And we've had that together now for about the last 2 years, mostly for educational purposes, but we recognized at some point we needed to have a governing body that could run the accountable care organization if we decide to proceed on the federal side, and frankly, if we decide to proceed with commercial insurance companies as well. And most recently, we added North American Medical Management. And the reason we did that is we recognize that while we're really good at running an integrated medical group and a hospital system, basically a hospital system, we really don't have a lot of experience getting in and operating independent physician practices. But that's what North American Medical Management, or NAM, does. They run IPAs, they help, as an MSO running physician practices. So by partnering with them, it gave a lot of confidence to our independent physicians that we could have a structure that helped them in addition to our large integrated groups. So that's how we've kind of formed Scripps Health, 7 medical groups, and North American Medical Management, forming the basis for our Accountable Care Organization board. In fact, we're incorporating it now and it'll be called Scripps Care.
And I heard you mention that there's some deliberations over whether to join the federal program. I'm just interested, there's been some pretty varied reaction to the regulations, kind of where you see that, where you see the Pioneer program, and just how you see Scripps going forward with that possibility.
Well, we've been pretty outspoken, and we've certainly communicated to DC, and AHA has been a great support for us. But the initial regulations coming out of Medicare Shared Savings were, well, disappointing, to be frank. Too much stick, not enough carrot, I think. It wasn't very realistic in terms of how healthcare organizations really deliver care right now in this country. But I hear they're at least receptive, and we'll see what happens with the final regulations. On the other hand, we've seen the dialogue with CMS around the Pioneer to be, as I've said, cautiously optimistic. They seem to be listening. They seem to be willing, on a case-by-case basis, maybe to adjust some of the regulations so that the federal government can achieve their goals, but the healthcare system can stay viable and achieve their goals as well. So I'm cautiously optimistic. Now, only 30 organizations will be selected, whether or not Scripps is there or not. We're going to file a letter of intent. We'll file an application, but we won't know for sure whether or not we'll jump in or not until we see what the final regulations are going to be, even for Pioneer. And even then, we don't know that we would be one of the 30. But at least we're in the dialogue with CMS. We're excited about that.
And kind of taking a look at the broader picture of accountable care, whether it's part of the formal initiative or not, I'm interested in what elements you see as essential to any successful ACO in 5 years.
Well, I think the most important piece is permitting physicians and hospitals to work together. I think our current regulations that are designed to prevent fraud, the Stark regulations and others that keep physicians and hospitals basically at bay, also don't allow us to work together really well to manage both cost and quality and to contract together. And until we do that, until we can somehow align the physician and hospital reimbursement together, we're never going to get the kind of support we need from our physicians to really change the way healthcare is delivered. We've completely restructured our healthcare system, and in this last year when we did that and we sliced our company basically horizontally, we identified $150 million in variation just the way our 5 hospitals practice. We also know that if we could find a way to integrate better and closer with our physicians, and accountable care should be able to do that, I think there's $150 million plus. I mean, we estimate somewhere between $150 and $300 million of variation with the physician practices. If we are allowed under the new regulations to work more closely economically with our doctors, I think we can improve quality, lower the cost of care through elimination of variation in best practices dramatically. And I think we could accomplish exactly what the government wants, higher quality, lower cost, and still stay viable as a healthcare organization at the same time. But the rules will have to change, and at least as they're proposed, the ACO regs might do just that.
Well, it should be an exciting year for you.
Oh yeah, I'm actually very bullish about the future. I think the fact that we're even having this dialogue, that our doctors are now having the dialogue with us about doing this, bodes very well for healthcare delivery in the future.
Well, Chris, that's all the time we have today. Thanks so much for joining us.
Thank you very much.